Hi everybody, my name is Benji David and today I'll be performing an IV insertion and discontinuing an IV. So before anything else, given a scenario, physician orders hydration for your patient, probably a 0.9% normal saline hydration to be given at a certain rate, a certain volume. So what do we do first? Of course, you check your orders, and it would be good to inform the patient of the procedure first before going on with the actual process. Why is that? Because the patient can always refuse that certain procedure, and refusing would mean you already have all your materials, you probably have your medication ready, and you've already taken it out from your medication bin, or probably primed it already. So that saves your materials and medication going to waste, right? And also saves you time. And another thing is that if the medication is to be given immediately to the patient, you would be able to inform the physician about the patient's refusal right away. Okay, so to prevent further complications towards the patient. Of course, after reorienting, reorienting the patient on risks and benefits of the medication and educating them about it. Okay, so before we go on with the procedure, I would like to go through the equipment first needed for this. Why is that? Once we're in the patient's room, we have to make sure that we have all the needed materials already. We have to bring it to bedside and arrange it in such a manner that everything is within our reach. That is very important. That comes in, that goes with safety as well. Okay, and success of your procedure. So let's go through the equipment needed for this. First, I have my sharper and Sharpie or marker. We have our gloves. We have our IV, okay, syringe, pre-filled syringe, and of course we have our IV start kit. So this comprises or has certain things needed for this procedure. One would be your gauze. You would have your transparent dressing. You would have alcohol peptide or an iodine solution for sterilizing the IV site. You have your tape and you have your tourniquet, right? Sometimes it would include um, your extension line, okay, extension tubing in there, and sometimes it would be separately packaged here, okay? Extension tubing, and of course the star of the show, our catheter. Okay? As you can see here, I have a 22 gauge, which is the color blue. All right, 22 gauge is a smaller gauge. So how do we know what gauge to use? All right, so that would depend on certain things. So one would be the type of patient that you have, their age. It could be an adult, a child, an infant. So that is one determinant. The next one is the patient's vein, where you're inserting it to. Okay, by this time, a good assessment is very important. Of course, by this time, you should already know at least more or less what type of patient vein your patient has. Is the patient dehydrated? Is it small or big, or moving, ruling, or you know, very small, thin. So that is another determinant. And of course, another important reason or important factor to consider when choosing a catheter is the type of fluids that you'll be infusing. Okay, the type of medication you'll be giving to your patient. So for me, it's a normal fluid, hydration fluid. So 22 or 20 would be good for this. But if you are probably like an ER nurse, you work in the ER, you need to administer a blood product, big volume, quick rate, fast rate. You will not catheter. You would use a bigger catheter, which is an 18 gauge or a 16 gauge, right? So that would be applicable for that situation, right? So there you go. Catheter size very important. All right, so you've already talked to your patient. They've given you consent. Patient said yes. Right, so let's now move on with the procedure. Good afternoon, Mr. Sunny. My name is Banji, and we spoke earlier about the new orders that your physician um, gave you for hydration, and I'll be inserting your IV for today. Is that okay with you? Great. Great. So thank you. Let's start. So you've entered the room, you've sanitized, you gathered all your things, you placed it at bedside. And also, I just want to remind you, make sure before you start, you are at a good working height with the patient. Why is that? That's for safety reasons as well. Safety for the patient and safety for you. You'll be working on the patient. Make sure you have room to move. You're at a good height in front of the patient, and make sure you don't break your back, right? Okay, safety for both. Okay, so we do hand washing after we fix everything. Hand wash. We are putting our gloves on, of course. So at this time, we are not touching the patient yet. We're not going to work on the patient yet. There's one more step before that, and that is to prime your line. Right? Why are we going to do this? What for? What is this extra step for? Well, it's one extra step that is very important. So we get our refill syringe, and I'll be using this extension line just because that my surface is small and that tubing is long. Okay, so we are priming for the purpose of not having any air to be injected into our patient, right? We do not want that there. We don't want any pulmonary embolism going on with our patient ever. Okay, so we are removing air from this area. Right? So you have your clamp, two ends. This is where the solution goes in. This is where is it? This is what is attached to the hub catheter, which goes into the patient. Okay? So what are we looking for here? Let's remember that. Make sure you have a place to set this at once it's primed. A good place to do that is the original case kit that it came from, right? Place it inside, but near you, where it's easy to reach. So we're gonna move this, making sure that you do not touch both ends, and clamp is open. We are going to now prime our extension tubing. Prime syringe, extension tubing. So what we're looking for is a few drops of saline coming out from this end. Okay. Few drops. 3, 4. Okay. So we're gonna set this down. Original packaging. Okay. So that's ready. We're now ready to work on our patient. Okay. So what do we do next? We take our tourniquet and we are going to find our patient's best vein. Okay. Let's see. across. Certain ways we can do this, using a tourniquet, using a blood pressure cuff, whichever suits your patient. Some use a warm compress. Make sure you're using a quick release knot for this one, okay? Which is critical later on. So after we apply our tourniquet, right, we will palpate for pulses, all right? Radial pulses. Making sure that our patient still has a pulse, right? So now, pulses, yes, bounding still. And um, we're now ready to inspect the vein. Inspect and palpate. Very important. You need to palpate. Okay. Now I'm seeing a vein there. Right. We're ready to sanitize our site. Cleanse our site. So now we can use an alcohol prep pad. There are several things that we can use. Sometimes it comes with this. Sometimes it comes with a prep pad. And sometimes it comes with an iodine cleansing solution. We're done. Okay? So whichever you use, it's the technique of applying it on the patient's skin that is important. Okay? So some you may do it horizontally. I'm sorry, horizontally. And then vertically for 30 seconds. And then for this one, or whichever, best thing to do, best way would be, so we're now cleansing our site. I'll be using the alcohol pad. Start inside, going outwards. Inside meaning where the site is, and you are moving outwards, okay? So sever the site. 3, 2, out. Right? So discard. Okay. So now let it rest. Let it dry. We are now going to get our catheter. So I have here, like what I've said, is 22 gauge, which is color blue. Okay. So make sure your position right. Okay. Everything's within reach, especially your extension tubing. I'm going to remove the cover. Start. Make sure your sharps container is within reach. If not, it could be at your car. There's a sharps container. Okay. So one more thing before inserting, make sure you're holding it properly the best way that is comfortable for you, because you will need to push this hub right here like that later on, okay, using your index finger, whichever is comfortable for you. So for me, I use my index finger and I stabilize it this way, okay. And now make sure before you insert that your bevel or the opening of the cannula is facing you, facing up, not downwards, but facing up, the opening, okay? So now what we're going to do after we sanitize, you're not going to touch that area anymore. If you really need to, you would have to get surgical gloves and, I'll work on that vein again, probably, yeah? Okay, so now we're going to, non-dominant hand, we're going to pull taut the patient's skin towards you. Okay, you're going to pull back. Why is that? We are anchoring the vein. We are stabilizing the vein. Okay, so it doesn't move. Veins move. They do. So you're going to have to stabilize that vein as much as you can. All right, so let's do that. Moving back, you have your bevel up. You have your finger ready, and you're just going to move it slightly. Make sure it's loose so you're ready to push later on. So we're now inserting at an angle. You see how I'm anchoring my hand, and we are at an angle. Usually I follow the angle of my thumb. Okay? And your index finger is resting. We're now ready to insert. Okay? Once you're in, you do not go out. So you've now inserted. What are we looking for now? We are looking for a flashback of the blood right here in this hub. I do see a flashback of blood already, meaning I'm in the vein, but we're not done yet. We're at top, and we are going to move down. Okay, why are we moving down the angle? Because if you push using the same angle, you're going to overshoot the vein, meaning you're going to go out of the vein, through the vein, okay? And once you start pushing that fluid, it's not going to go into the vein at all, right? All right, so we're going to move down, and we're going to move forward slowly, a few inches, and now it's time to advance your hub. Okay, once you're at the end, get this finger, stabilize the end, occlude a little bit. This is the critical part, okay? So we're gonna, once you're advanced already on this part, we're gonna remove this card, remove the trinket, prevent further bleeding, and quickly attach your extension tubing to the end of the hub, okay? So we are now attached, just to show you. So now we are stabilizing still. Remember, this is open because we're going to be pushing this one, so, the saline. But before we push, we are going to aspirate just to make sure that there's blood return, and meaning we are in the vein. We aspirate, I see blood return. I'm now going to push slowly. Okay, we're pushing. So while I'm doing that, I'm checking the site, right? And I'm listening to the patient because they will let you know if it is painful. If it's painful, something's wrong, stop pushing saline and assess the site. If it does hurt still, remove and do it again, right? Okay, meaning you're not in the vein. Okay, it shouldn't be painful. A tingling feeling, yes, but it shouldn't be painful. And then, so once we push the saline in and there's no swelling, there's no redness or blood coming out or fluid coming out from the site, because it should be in the vein, it's not supposed to come out. So meaning we're in the vein, we're good to go. We are now going to secure our hub. Tape. Usually this is ready already. Okay, longer a little bit. We're just gonna secure it right here. Never put tape over the insertion site. Okay? Just there, just to stabilize while we get our scar dressing. Okay, so we're gonna remove, start, and then we're gonna set it over the site. Pressing down slowly. Alright, make sure it's intact. And now we're going to peel off. These things are different everywhere. It would differ on the size, differ on the borderline. But what's important is the procedure and the placement. Okay, clean, no swelling, And now what we're left behind is this one for our initials, the date, and the size of the gauge. Okay, but before we do that, we're going to loop around this part. Okay, now first we lock. Usually we put a cover here to keep it clean. It's color green. Okay, we secure it, loop it around the side of the patient. Make sure that this is to make sure that our line stays patent and it doesn't get moved too much. Never tape over the transparent dressing. Okay. So usually it would be a bigger space. Okay. So now that it's secure, right, we are going to label our insertion site. And my initials, the date to date, 6, and your gauge, which is a 22 gauge. Right? Why are we labeling? It is because dressing should be changed regularly depending on facility protocols. It could be weekly, 5 days, depending on the type of medication given as well. Like if it's strong medications, you don't usually reuse maybe span of three infusions or 3 days. But usually it's a week for normal infusion. So there we go. That is our identification. Part of that. So we're assessing still up to now, making sure everything is intact. Ask the patient if he feels any pain or any reaction or anything. So let him verbalize. And then we are now going to remove our gloves, making sure that the area is clean. No needles is left behind. Everything is in the sharps area that needs to be there. Okay. And this is how it looks like. There should be a cover. Right. Okay. So wash our hands after. Okay, after we remove our gloves, and then you talk to your patient, educate them. So that is our IV insertion. So now you get an order. Patient is going home. Okay, patient still has the IV on his forearm, so it needs to be removed. The provider gives an order to discontinue the IV. So you check your orders, make sure it's the right patient that you're removing the IV from, and you inform the patient that you'll be removing the IV before he leaves. Right? So you enter patient's room and hygiene. Okay, put your gloves on. And then you explain to the patient what you'll be doing. So, Mr. Sunny, my name is Banji David, and I was given an order to remove your IV since you'll be going home at 12 noon later on. So, is that okay with you? Patient says yes, agrees. So, let's start. What are the equipment needed? You would only use some clean, sterile gauze. And sometimes you have an adhesive remover depending on the patient's status, skin. And that's it. Gauze. Okay. So now what we're gonna do is we're gonna remove the tape first. Okay. And yeah, you need your tape. All right. And we're gonna start from this loop area. That. This is clamped. So it would be good to start from the top moving towards you. So meaning that's moving towards against the way of insertion. Okay, if it's bottom, we're just going to try and loosen up the bottom. Sometimes it's good to go top, bottom, moving up as well, depending on the site. Okay, so we're going to stabilize this area. Okay, and we will be moving away as well. So for this purpose, we are moving away. Okay, while stabilizing. So now everything is removed. You inspect the site. There's no swelling, there's no redness. It's still intact. Just get a piece of gauze. We're going to press on the insertion site a little bit, apply pressure a little, and we're going to go in one fluid motion, moving backwards to remove the catheter, okay? One, two, three. Okay. So now as you can see, right, it is intact. We check for the integrity of the catheter, okay? But before that, you have to inspect your patient and make sure that you're applying pressure for apply pressure for at least 30 seconds on the patient's skin to stop the bleeding. Depending as well on the type of medication your patient takes. If patient takes anticoagulants, you would have to press longer, as long as 5 minutes, okay, just to prevent excessive bleeding, okay, and you will check every now and then, right? So right now, let's say there's still a little bit of bleeding. While doing that, you're checking your catheter. You're making sure that it's intact. It's the same length, the length of it. And there's no, it's not, we call this, nothing is left behind on the patient. If that happens, you have to inform the MD right away and they will make the necessary orders to be done or test for the patient. Okay, so you have to report right away. So everything's intact. We are in the sharps area. Right, everything should be in. And now that you assess, bleeding has stopped. You can remove this card. We're getting another clean one. You're folding. You're applying tape to secure. While doing that, you are educating the patient on how to or when to remove this. And if patient experiences any pain or swelling, massive adverse effects like itching, to inform the provider right away, his MD right away, his physician, okay, if there's any adverse reactions. So at this time, just make sure the area is clean. Everything that needs to be in the sharps is in the sharps. Everything's thrown away. Patient is stable. No bleeding happening. And we remove our gloves. Part, we do hand washing, and that concludes our discontinuation of an IV, discontinuing an IV. So that's it. Thank you so much, and I hope to see you soon. Bye.